Good evening, and thanks for coming out tonight. I appreciate you making the effort. My name is Steve Snyder. I am the registered nurse diabetes educator at Salem Regional Medical Center. Welcome and thank you for coming and attending our annual Diabetes Health Fair. November is National Diabetes Month, and let me share some statistics with you that recently came out. And these are from 2012. Diabetes today affects nearly 30 million people. That's on about 9 to 10% average of the U.S. population. Among U.S. residents over the age of 65, diabetes impacts almost 12 million people. And these numbers were from the year 2012, and these are our most recent numbers. So you can imagine today's, if we did a polling, the numbers would be even higher. So we thank you for coming out and attending an event like this so we can share a little bit with you about how you can learn to manage your diabetes so your diabetes doesn't manage you. Also, we'd like to take this time to encourage you that if you have not attended any of our diabetes education programs at Salem Regional, to talk to your physician about sending in a referral to attend one of our classes. We offer group and individual sessions. We can do one-on-one. We also have information tonight at our table that talks about our program and how to go about signing up. We offer classes several times during the month, different times, and different days. At this time, I'd like to introduce the other member of our diabetes education program. Is my partner back at the table, Julie Stefani. She's our registered dietitian. And earlier tonight at the table was Jackie Boyle. She's another registered nurse, and she's our certified diabetes educator. And before I introduce our speaker tonight, I'd like to thank all of our vendors for their participation in tonight's event. If you haven't stopped by earlier, please do so at the end of our evening, and they have information to share with you. They've also been very gracious enough to bring along door prizes that we'll be drawing for after the end of Dr. Sevilla's presentation. And so I'd like to thank the different representatives and vendors we have with us tonight. From Salem Regional Medical Center, we have the Wound Healing Center. We have Salem Regional Medical Center represented by our Public Relations Department. We have the Behavioral Medicine and Wellness Center, our Food and Nutrition Department, Salem Home Medical, Sleep Lab, and our pharmacy. Other vendors, representatives that we have with us tonight, we'd also like to call out and thank them is from Novo Nordisk, the Diabetes Partnership with Mahoning Valley, the Ankle and Foot Care Centers, and from the Eastern Regional Kidney Foundation. And lastly, we'd also like to thank the Salem Community Center for providing this wonderful space for our event. Tonight, our featured speaker is Dr. Mike Sevilla. Dr. Sevilla is a family physician here in Salem and a member of the medical staff at Salem Regional Medical Center. In addition to his practice, he also holds an academic appointment as an assistant professor of family and community medicine at Northeastern Ohio Medical University. Dr. Sevilla is also known not only nationally but also internationally for his expert opinion on social media and medicine. You might have also seen him on some of his TV interviews with WKBN, sharing his medical expertise on a variety of subjects. He also has a presence on the internet. Dr. Sevilla's website can be found at drmikesevilla.com. So if you'll join me, please welcome Dr. Sevilla tonight. Thank you, Dr. Sevilla.
Thanks, Steve. All right. Good evening, everybody. All right, lively crowd. We like that. So I'd like to thank Steve, and I'd like to thank Salem Regional Medical Center for the opportunity to speak to you this evening. Just out of curiosity, how many people have were able to kind of see the new patient tower and kind of walk around, especially when they had their little tours over there? Were people able to kind of see that over there? All right, great, that's cool. So as Steve noted already, you may have known me from being on WKBN, talking about health issues, including diabetes. And you may have known me from something like this, the hospital. That's the old name of the hospital. But a couple years ago, they put a bunch of physicians on billboards to help advertise the hospital. It's very nice of them to do that. But tonight's topic is diabetes. And so I'm in private practice here in Salem, and I do see some familiar faces in the audience here this evening. So I'm at the Family Practice Center of Salem, and that's who is with us there. How many people have a primary care physician? Family doctor? Everybody? Oh, people who don't, talk to me afterward. I might know somebody. So before I get started, I just want to say that I am a doctor, but I am not your doctor. So the things that I talk about tonight, you should get your own personal advice about your health issues, including diabetes, from your doctor. So, but we're going to be talking about some things in general tonight when it comes to diabetes. As Steve noted, November is National Diabetes Awareness Month. And so you may have seen some things out there in newspapers or on the radio that this whole month is devoted to diabetes education and increasing awareness about it. And that's probably part of this program this evening. Now, this is something that's very important. I mean, we're going to talk about things like technology later, but the important thing I want to get out tonight is to talk about diabetes, to talk about what you need to know about it. And this slide is probably the most important slide that I'm going to show you here this evening, okay? You should know your ABCs of diabetes. And so the A stands for your A1C test. And you're probably familiar, that's kind of your 3-month report card about how your diabetes has been doing. I have a lot of patients who come in and the night before or the week before, they are very, very good about their diabetes. Yeah, I hear that, see? But when we get this test, we can kind of see how have you been doing. And we don't do that to embarrass you. We don't do that to be mean. We all want to have your health to be most important. And this number is very important. And if you don't know what this is, you should talk with your doctor about what your hemoglobin A1C or your A1C test is. And we want to keep it, depending on what your range is, 6 or 7 in that range there. But if you don't know what your A1C is, you should know what it is. You should write it down. You should track it. You should talk to your doctor about that. Now, the B of the ABCs is blood pressure. And you should know what your blood pressure is. Some people have their blood pressure machines at home. Some people track that very closely. As many of you know, there are a lot of different blood pressure medications out there. And also, in addition to that, avoid your salt, avoid certain foods, try to limit or eliminate things like coffee and caffeine, which can raise your blood pressure. So the B in blood pressure, that is something that you should definitely know and be aware of. The C in your ABCs of diabetes is cholesterol. And you should know what this number is as well. Because we know that as you have increasing cholesterol numbers and increasing blood pressure and A1C numbers, that leads you to bad stuff like heart disease, heart attack, stroke. So you should know what your cholesterol medicine, or you should know what your cholesterol number is, and if you need to be on medication, then you should ask your doctor about it and see what kind of options you have for your cholesterol, in addition to making good choices in what you eat and increasing your exercise. And the S is stop smoking of your ABCs. I'm not a smoker, and my parents were not smokers, but I have a lot of patients who talk to me about, stopping smoking is very, very difficult for one reason or another. They started when they're early. Some people use it for stress. But for your health, for your diabetes, for your high blood pressure, stopping smoking, we know, is one of the most important things that you can do for your health. And there's a lot of different options out there to help you stop smoking. I'm not saying that it's easy, but this is also a very important thing to do, to optimize, to make sure your health is as best as it can be. Now, here are some other things that I'm going to talk about here in managing your diabetes. Use your diabetes meal plan, and it should be individualized to you. If you don't have one, if you're not familiar with one, I would talk with your doctor about it, talk to the dietitian about it, talk with your healthcare team about it, because each person is different, because each person has different needs for what they have. Not only do you talk about sugar, you talk about salt, you talk about your other medical problems. One diet does not cover everybody. You should know exactly what you should be eating, what can lead you into trouble. Getting exercise is also very important. 30 minutes, most day of the week. I'm not saying that you have to run a marathon every day, but to get up and be active. I have a lot of patients who have a lot of struggles with this, especially when they have joint problems or arthritis or those type of challenges. But if you try to fit that in your schedule, I know it's going to be a lot more challenging, with the weather getting cooler. But we do know that there's a lot of good studies out there that if you do, get your 30 minutes most days of the week, that's going to help your diabetes. And take your medications, even when you're feeling good. I have patients that talk to me about this every single day. They say, Doc, I feel great. I'm going to hold off on this pill today, or I'm going to hold off on this shot today. It's probably the worst thing that you can do. People get a little bit overconfident. They feel good. They start to forget about some of their medicines, and then they start to get into trouble. Check your feet every day. This is also something that's very, very important. Because you probably heard of stories. You probably, have friends or relatives who have had, foot problems or have had surgery because of complications of diabetes. So it's very important to not only check your feet every day, but to talk to your doctor about any kind of symptoms that you have, numbness, tingling, any of that type of stuff. And obviously check your blood sugar. How often should you check your blood sugar? You should talk to your doctor. You should talk to your healthcare team about how often you should check your sugars. And I do have some patients that call my office and say, this is what my blood sugars are this week or 2 weeks. What should I do about this, doc? So you should definitely have good communication with your healthcare team about what your sugars are, because there's some times where you can make some little itty-bitty changes in your medications, or getting more exercise or watching your diet to get that blood sugar under better control. And of course, get your flu shot. I have a lot of people saying, Doc, I'm not going to get my flu shot. I get the flu from the flu shot. You can't get the flu from the flu shot. Okay? It's probably the most important thing that you can do, especially this time of year. There's other adult immunizations out there as far as the pneumonia shot and as far as the shingles vaccine. There's a lot of preventative things that you can do as far as immunizations to optimize your health. So the second part of the talk, I'm going to be talking about technology. That's something that is that I'm passionate about. Do you have the speaker? Can you get the speaker? The audio speaker?
That I brought back.
Yeah. I'm sorry about that. Yeah. So, kind of modifying things on the fly here. So, so I think technology is important because it can really help you not only with your diabetes but with your health problems in general. We talked about blood pressure before. The technology now is that people can take their blood pressure readings at home, and obviously you can do your blood sugars at home. There's a lot of blood sugar machines where people can save their blood sugar numbers for a number of days. So you can kind of see what your trends have been over the past few weeks, and you can bring that into your healthcare team, you can bring that into your doctor and talk about, hey, your sugars have been, in the 100s or 110s, and that's pretty good. Or your sugars have been in the 160s or 170s, and we have to make some changes about that. So I'm just going to share with you just some examples from the technology world that we're seeing now. And especially people with juvenile diabetes or type 1 diabetes, there's a lot of technology that is being used now to help those type of patients balance their sugars and know what's going on with their diabetes. So just a brief example here, people have these phones now that people are able to kind of hook in their glucometer, their blood sugar machine right into their phone, and they're able to save their blood sugar readings in there, and sometimes they're able to send that to their doctor, send that to their healthcare team, so they can be able to keep in contact with them and say, hey, this is what my blood sugars have been over the past week or over the past month. And there's also technology out there to help you, encourage you, and to help track your exercise. And this app right here is called Walk Meter, and I have it on my phone as well. And what it does for me is that it helps me and it reminds me that I have to walk more. And the cool thing about this is it can save, how far you've walked or how far you've biked. I like to go down, to Lisbon to the Greenway Trail down there, and my wife and I, we go down there and we walk, we take our bikes, and what this technology does is it's able to save, how many days or how many days in the month that we exercise. And people really need that. People really need that kind of emphasis and say, hey, I don't know how much walking I've been doing over the past month. This is technology that really can help you do that. And there's also technology out there where you can, people really track what they're eating these days. People use notebooks, people use kind of notepads. There's a lot of people that use their phone as well. And they write down everything that they eat in their phone. And these phones now and this technology now is they can tell you how much calories, how much grams of fat, how much carbohydrates are in what you're eating. So you can keep very, very close track of what you're eating, how much you're walking, and you can even guess how many calories that you have eaten or how much you have spent through the day. So, because people ask me all the time, Dr. Savella, I don't know why I gained 5 pounds in the past month. Well, let's kind of look at things here, because this is what you ate, and this is how much you exercised or didn't exercise, and this is how much calories that you have more each day. Those add up into pounds, and those add up to higher blood sugars and to higher blood pressure and increasing hemoglobin A1C. All those ABCs that we've talked about at the beginning of tonight's talk. So that's what technology can really help you do that. And if you have one of these phones, a lot of these applications or apps are free, and you can just put it on your phone and you'll be able to do that. Now, just because you don't have a phone doesn't mean you can't do that. I have patients all the time that bring in their huge big notebooks with them. And they say, this is what I've eaten. This is how much I've walked. I walked the dog this day. So whatever you need to do to help track yourself, because you're the only one that can really do this. And your healthcare team, your doctor is there to help cheer you on, but we can't do it for you. So whether it's through a phone or through your notebook, whatever you need to do to track what you're eating and how much you're exercising. That's something that's going to help you, and it's something that's going to be really great for your healthcare team and for your doctor. How are we doing?
I'm not sure if it's working or not. It doesn't power on. I don't know if there's supposed to be a light or not. At least your sensor would be.
Well, let's kind of keep working on it. So another thing with technology now is that they have these things where you can know what your blood sugar is right now. Of course, you can take it with your own blood sugar, but they have what are called continuous glucose monitors now, where people can hook themselves up and see what your blood sugar is right now. There's also things, especially for type 1 diabetes, for juvenile diabetes, they have these insulin pumps where patients can know exactly how much insulin is going in. And they also track how much they're eating, how much they're exercising. And so it's kind of cool what's happening now with diabetes and technology. And this picture is from a friend of mine, and he has an insulin pump, and he also has a continuous blood sugar machine, so he can track what his blood sugars are right now. This is important because everybody in this room has probably have experienced very high blood sugars or very low blood sugars, and people can get sick if you get very high blood sugars or very low blood sugars. And what he does with this technology is he's able to share his blood sugar readings with his family. And why is that important? Well, because if you're sleeping and your blood sugar goes really low or really high, that could be a bad thing, and you may not know that. So this can be something to alert his family, because as everybody knows, if you have high sugar or low sugar, you may not be able to think very clearly. So this is another way how technology can really help patients know what their sugar is, so they can take whatever the next step is. So I love technology. Okay, I think technology can really help patients. Okay, and I go out there on the internet and I talk about that. And a lot of people are scared. A lot of people are afraid of the internet. There's a lot of bad things that happen out there. But I kind of turn that around. I think there are a lot of good things that can happen. There's a lot of good connections that can happen. I've met a lot of patients with diabetes. I met a lot of doctors who take care of patients with diabetes from all around the world. And this is a way that we can have a conversation about it. And I think that we can help each other when it comes to diabetes, when it comes to other types of diseases. Now, why do I think the internet is important? Why is it important for me as a doctor? It's important for me as a doctor because we know, and they've done some studies, that 60% of patients go to the internet and look up their condition even before seeing me. And that's something that I've been experiencing more and more through the years. So it's important for me to know kind of what's out there. And it's important for doctors to know that patients are doing this. They don't ask our permission to do that. So I need to know kind of what people are talking about out there, whether it's diabetes, whether it's a medication, whether it's a treatment, whether it's something that people are talking about out there. But that's why I think that the internet and social media are important, because patients are really pushing doctors to learn about this stuff. And I like to talk to doctors about this because it's important for them to know. Okay. Now, for people who have looked up stuff on the internet, there's been this study. It says, do not try to diagnose yourself on Wikipedia, which is one of the websites out there that people use to diagnose themselves. Because 90% of stuff on that site is not accurate at all. And people bring this stuff to me all the time. They say, Dr. Seville, I found this on the internet. Is it true? And I usually say, no, it's not true. But people get scared about it. You know, the people out there on the internet like to scare people. So that's why I think it's an opportunity to talk to patients about what they find out there, because this technology, I think, it can be used for a lot of good, but sometimes it is used to scare people. And as Steve noted before, you know, this is kind of my home on the internet there. I talk about things that are interesting to me. I talk about technology. I talk about how technology can really be used to help patients, and I think it's a good thing. I also do some funny stuff like this, where I talk with other doctors, I talk with patients about interesting things in health and medicine that are important to us, that are important to patients. Now, if you're on the internet, and if you want to get good information, you know that the American Diabetes Association is a great place to get information. It has good information. It has accurate information about what you want to learn about diabetes, and they have a lot of great articles there, and they have a lot of great suggestions on there as well. So if you're out there and you're searching for stuff, you know, the American Diabetes Association is probably the first place to kind of look at that. One of the cool things about technology and the internet and what's out there is there are a lot of people out there who want to share their story out there, especially about diabetes. I have learned a lot about diabetes from going out on the internet and looking at websites and blogs and things like that, and seeing what people are talking about, to share their experiences. This is a friend of mine who is in Rhode Island, and she is somebody with type 1 diabetes. She was diagnosed at age 6 years old, and thus the name of her blog or her website called 6 Until Me. And, you know, I've learned a lot from people like her who are living this every day. And the reason why she started talking about this on the internet and on social media is because she felt like she was the only person out there with diabetes. She felt very alone. And she uses technology and she uses social media to share her story, because there are a lot of other people out there with diabetes who have the same questions that she does. There's a lot of questions that all of you have. And there have been, you know, support groups, diabetes support groups around forever. But with technology and with social media, you're able to have kind of a support group from all around the world. And it's a fascinating thing to have a conversation and to have a dialogue with somebody who have the same questions, going through the same challenges you are, and how you deal with it. What's interesting here is that in this essay that she talks about Halloween that just happened. And if we get this working, but there's a video here that she talks about. She was diagnosed with diabetes right before Halloween when she was 6 years old. And her first holiday was Halloween. And the struggles that she went through as a child, there's all these kids with all this candy around, and she shares her story about how struggling it was for her. And you know, probably all of you have some struggles too, now that the holidays are coming, watching your blood sugars. So this is a great way for her to kind of share her story and to have a conversation about that. So just kind of closing up, you know, this is, you know, National Diabetes Awareness Month. And on November 14th is World Diabetes Day. So you may see some things out there in the newspaper or on the radio or on television, just trying to raise the awareness of people with diabetes, and to kind of share your story out there too, because any kind of ongoing or chronic disease, whether it's diabetes or heart problems or whatever, it's a tough thing to have. So thanks for your attention tonight. It's been great talking with all of you. I know we do have a few minutes for some questions.